In today's video, I'll be sharing with you guys how to use Differin gel in the treatment of acne. Hello guys, and welcome back to the channel. If you're new here, welcome. I'm Dr. Janet of jdiva.com, and on this channel and on my blog, I talk on skincare tips, relaxed hair, and personal development. So if these are topics you love, please subscribe and turn on the notification bell so you know when the next video goes live. Now, someone who has oily and acne prone skin and has dealt with moderate to very severe acne myself, I can tell you that getting your acne under control can be a huge deal. So today I'll be discussing one of the first line medications in the treatment of acne that I see a lot of people using wrongly. So I'm going to be throwing more light on how to use it so you can get the most out of it. This Differin gel is an anti-acne treatment made with 0.1% adapalene, and adapalene is a member of vitamin A derivatives known as retinoids. I have a playlist on my channel where I talk on what retinoids are, the different types, how to pick the very best retinoid for your skin type and concerns, and then reviews of retinoids. I will link it up here. Retinoids are either natural or synthetic, and based on their structure and when they were discovered, they can be classified into 4 generations. Now, adapalene is a synthetic topical retinoid and is a member of the 3rd generation retinoids. Adapalene comes in 2 strengths, 0.1% and 0.3%, the 0.3% being prescription only. Now, this one is 0.1%, which you can get over the counter. This Differin gel is marketed for the treatment of mild to moderate acne. Now, acne is the most common skin condition and it arises when our pores get clogged. Now, our pores can clog from either excessive sebum production, dead skin cells that don't shed so they clog the pores. Now, the presence of Cutibacterium acne, which is the acne forming bacteria, or when there's inflammation. Now, acne is most common around areas where there are so many sebaceous glands like the face, the upper back, and the chest. Now, how this works is when you apply to the skin, it binds to receptors on the skin, and this causes the skin to shed more rapidly than it usually does. And when you're acne prone, keeping your pores unclogged is very, very important. Adapalene is lipophilic, so it's one of the few retinoids that can easily penetrate the lipid matrix into the pores. So it has more acne fighting properties than anti-aging properties. So if you're very oily and acne prone, this is one of the best retinoids for you. When you start using this product, like most retinoids, you might experience a period where your acne gets worse. This is known as the purging phase or the retinization phase. This is basically the period when your body adapts or adjusts to this retinoid. Now, because retinoids work deep within the skin to increase the cell turnover rate and to unclog the pores. Now, microcomedons, these are like baby acne being formed under the skin, are brought up to the surface because of the increased shedding of the dead skin cells. So it may seem like your acne is getting worse, but if you push through this phase, you'll get clearer skin on the other side of the tunnel. In this purging phase, you could also have redness, dryness. So even though this is a good product marketed for the treatment of acne, you want to start very slow. You want to give your skin time to get accustomed to the product. And if you have sensitive skin, your skin barrier is already finicky, so you don't want to overuse your retinoids. So you want to start really slow when you have sensitive skin. This product contains methylparaben. In skincare, parabens are used as preservatives now, but they can be very sensitizing and they can leave your skin very susceptible to UV damage. So especially for those with sensitive skin, this may be overly irritating for your skin. Now, it comes in this tubing. It is airtight and light proof, so it doesn't get broken down. Now, it's a very lightweight gel formulation. See how lightweight it is? It gets easily absorbed onto the skin very quickly. And it is very drying. When it gets absorbed, your face feels very dry, so you need to go over it with a moisturizer. Now, adapalene is broken down by light and leaves your skin prone to UV damage. So you want to use it at night, and then on the next day, you want to use sunscreens before you step out of the house, even when you're indoors. Now, on the days when you use this, you don't want to use other skin actives because it's going to overly irritate your skin. Now, you always start off your evening skincare routine by double cleansing. When you are oily and acne prone, you need to double cleanse. I swear by double cleansing. Now, it is based on the premise that like dissolves like. So when you use an oil first, it goes in, breaks excessive sebum down, breaks waterproof makeup, and then you go over it with a water-based cleanser. Now the oil cleanser I use currently is a simple hydrating oil cleanser, and then the other one I use, especially when I was breaking out, is the CeraVe Renewing Essay Cleanser. This is so good. This is one of my favorite cleansers to use, especially when I have active acne. It contains salicylic acid. Salicylic acid is a beta hydroxy acid. It is keratolytic. It can slough up dead skin cells. It has anti-inflammatory properties. So it works hand in hand with adapalene to clean out your pores. A salicylic acid cleanser or benzoyl peroxide cleanser is very important to have in your routine if you deal with acne. I'll link some in the description bar below. Now when you're done double cleansing, it's time for the star ingredient, your adapalene gel. Now you need only a little amount of this. You apply to the face thinly, and then you always go over this with a moisturizer. You always use a moisturizer over this so it reduces the amount of dryness you experience. Use a very light basic moisturizer. You don't want moisturizers with a lot of active ingredients because it could irritate your skin. When you use this, you want to avoid the areas around your eyes, the corners of your nose, and the corners of your mouth. If you're trying to conceive, pregnant, or breastfeeding, you may want to avoid adapalene. Now, a few studies have shown that the serum levels of adapalene after application is not high enough to cause malformations, but most retinoids cause malformations, so it's better to err on the side of caution. It's very important to know that you don't want to use other skin actives with adapalene in the same routine. Skin actives like alpha hydroxy acids like glycolic acid, lactic acid, and beta hydroxy acid like salicylic acid. Now you can use salicylic acid in a rinse soft form like in cleansers, but on leave-on forms it can be overly irritating when you incorporate it with retinoids. So this is very important. A good way to incorporate it into your skincare routine is to alternate these skin actives with your retinoids. So you use your retinoids this night and you use the skin actives the next day. You just alternate. Now when you're on this product, you want to closely observe your skin. If you experience any excessive irritation, it's a very good time to stop. Baby your skin, stop all skin actives, allow your skin to rest, to breathe. Just wash your face and apply a simple moisturizer and allow your skin barrier to heal itself before you come on with your retinoids again. And even when you come on with your retinoids, you want to start slow, very slow. Remember, slow and steady wins the race in skincare. I hope you found this video very helpful. If you did, please give it a thumbs up and click on the subscribe button below, and I will see you guys on the next one. Bye.